Hey guys, welcome back to another episode of Unmasked Health with your host Shelly. I'm doing another episode this week on sexual health, trying to unveil or reveal or debunk myths that men have or have studied or researched or Googled about sexual health, penis health, the whole nine yards, and answering some questions that I've received. So this week, I'm going to be discussing penis health, shrinkage, size, myth, those sorts of things. So, and I'll just start out just being blunt. And you're a male, and I'm a female, and I've just through my research and talking to other men, this is what I have gathered. But men lie about the size of their penis, and the penis is not determined by the size of a man's foot. That's a myth. And I'll start out by letting you know that the average size of an erect penis is 5.1 to 5.5 inches. But usually it's closer to the lower side of this range, so closer to 5.1, 5.2. So, what is it that warps your opinion about the size of your penis, about your penis altogether? Well, it's the industry, quote unquote. We unfortunately have an addiction problem in this country across the world to porn. So it's industry related. There's other forms of social media and of course society. And I'll start off with another myth. Penis size determines the benefits, and that's not true. There's no such thing as having a normal quote unquote penis. There's not a single man on this planet whose penis is going to exactly match another man's. Not on size, not on shape, not on texture, not on, you've got the same freckle as another man's, there's no penis that's just alike. So every male's penis is different. They all vary in size and shape. Some are curved, some are not, some are wider, some are shorter, some are wider and longer, some are thin and short, thin and longer, and you kind of get what I'm kind of getting at there. But there's no single penis that's the same as another. But doing my research, and I kind of knew this already, and you probably already know this too, being a man, but the number one questions Googled by men is my penis size normal? Followed by what is the average penis size? And so that kind of goes back. That's the reason why I kind of opened up that the average size of an erect penis is 5.1 to 5.5 inches. And to men, this is extremely important, as a society. And men have warped other men's ideology of what a normal penis should look like. That is very important for you. I get it. Like, I know that, it's just like women comparing their boobs to other women's boobs, right? Or their weight or their eyes or hair or whatever. Men also lie about their height. So, and they're usually off by 1 to 2 inches. And it's just a societal thing also. It goes back to the whole masculinity thing, that you're not as masculine if you're not as tall as the next guy. But I kind of wanted to touch on each episode from also a healthcare standpoint, because I'm a provider, but healthcare is extremely important. And we know that men do not take care of themselves as much as their counterparts do. At the very beginning of my podcast, we talked about that. Men don't go to the doctor. You don't take the time to do that. Either you're scared to go and find out there's something wrong, or you just don't make the time to go and sit down and, get your health screenings in place. But today, what's important that I want you to know is the function and the health of your penis is what matters. And what do I mean by that? Well, it doesn't really matter what the size of your penis is if it doesn't get enough blood flow, right? So what affects that? Well, we go back to chronic conditions like high blood pressure, diabetes. Do you have clogged arteries? Have you gained weight recently? Do you smoke or drink a lot? Those are things that you as a man, no, smoking and drinking and weight are what you as a man, anybody really, but we're focusing on men, can control to improve your penis health. Now, when I'm talking about high blood pressure, diabetes, the clogged arteries, you have the responsibility to, yes, go and get screened. And if you do have those conditions, then do something about it. Take the medication or change your diet or, whatever. Add fish oil, omega-3, whatever you and your provider decide to do. Some of these conditions are inherited. So you can't help that you have the gene that your dad passed down to you for high blood pressure. You've got it. So, but you have to take control of it and not let it control you. But overall, these things can affect your penis health. And so it leads me to another myth to debunk. And you can Google how to make my penis bigger and find hundreds of marketing gimmicks out there. On products that promise to grow your penis. And let me just be very clear and just honest. I would like for you to. I would like for you to try. I would like for you to start adopting this behavior. Stop wasting your money. I mean, look at it this way. These companies know the way to a man's pocketbook is through his pants. And it's promises of 1 to 2 extra inches if you take this or use this or do this exercise. And guys, it's just not true. If it were true, let me just put it to you from my philosophy on this. If all of that were true, if there were devices out there, if there was a pill that you could take, if there were exercises that you could do that were going to make your penis grow 2 inches, then my philosophy is that they wouldn't have to spend millions and millions of dollars on commercials, ads, etc. If their products really did work. And I relate that to, we all know Chinese food is good, right? We all know that, it's there, it's available, whatever, but Chinese food places don't have to do commercials or ads because people already know it's good and they eat it anyway without having to read gimmicky ads. And so you should be more concerned about your health screenings, meaning go and get, go and get your annual wellness exams, be more focused on your nutritional foods, losing a few pounds. We can all lose a few pounds, being active if you want your penis to remain functional. So and I kind of want to throw this in there to hopefully kind of, alleviate some of the anxiety that men have. 85% of women that were surveyed out of approximately 50,000 are satisfied with the size of your penis. Size to women is not a major issue. Now, I'm not saying that's for all women, but I'm telling you, a majority, 85%, that's a huge number of women said that it wasn't a major issue to them. Oh, and I'll go on to say that however, approximately 20% of men will stretch the truth about the actual size of their penis to their friends. And so how can men start telling the truth? Well, first, that women really don't care. I mean, we're not really concerned about the size of it. We're more connected emotionally than we are worried about, the size of your penis. But really, I know it really matters to you as a man, and it's such a common topic among groups of men that you kind of like pick at each other, or you compare, or you're in the locker room, or you're sitting around, outside grilling, and it's always going to come up because that's just what men do. It's a common topic for you. But instead of lying or exaggerating, just be truthful. I mean, society as a whole has gotten away from being truthful. And if you're not going to be truthful with others, at least be truthful with yourself, because you would be doing yourself more justice. So, there are things that you could say like, yeah, I used to be insecure about it, but whatever, it doesn't define me, or my wife's significant other doesn't complain, blah, blah, blah. Be authentic with yourself and others. If you want people to take you serious for who you are, respect you for who you are. And look, I'm not saying go out and shake a man's hand and be like, hey, my penis is 5.5 inches. I just need you to know that. That's not what I'm talking about, but if the situation comes up and the conversation is very frequent, from what I'm gathering from my male friends, that is something that is talked about frequently, or it's brought up not every day, but once a month, once every 6 months, whatever. Be authentic with yourself and others. Lying will disconnect you as a man from real intimacy, because again, you meet somebody and you're like, yeah, I'm well above average, 8 inches, whatever. And then the time comes and you're just 5.3 inches. And then they're going to, whoever's going to be looking at you going, dude, if you'll lie about that, you'll lie about anything, but just don't lie to yourself and don't lie to other people about it. If they're asking, truth and humility build strength. You don't need inches to claim your masculinity. Someone that's 8 inches versus someone that's 5 inches is not more manly than, somebody that's 10 inches and 6 inches, whatever. You know what I'm saying? Share this podcast with your male friends and family, etc. Now, so that they can learn the facts about it. A lot of men, Google may not always be the truth. They're not always going to tell the truth. You're not always going to find accurate articles or accurate answers on Google. But, the average size, again, is 5.1 to 5.5 inches on erection. Maybe there are people in your group that need to hear this, that maybe lying about whatever. And I don't know, maybe I need a man to reach out to me that can be like, hey, we really don't care, or whatever. Like, is it more of a joke thing? Is it more of a pride thing? From what I've gathered so far from the few I've talked to, it's more of a pride issue. But I really don't know how to feel about that, because men walk around nude and nudity, at the locker room, the gym, sports people, athletes walk around, walking around nude, whatever. But I would be interested to know what male listeners have to say in response to all this. I would be interested to know. But let's talk about another very important thing about penis health is shrinkage. Should you be worried? And the answer is usually no. You should not have to be worried. That's usually mild or temporary, but it happens to every single man. So when should you worry? When should be the alarms be going off? Well, when it's persistent or it's progressive. This can point to underlying health or vascular issues. So what does all that mean? Well, what's normal shrinkage? Well, normal occurs, as you know, during cold temperatures because the blood vessels constrict, during periods of anxiety or stress because you're in a flight or fight mode, and that redirects blood away from the genital area. Dehydration or physical exertion, there's less circulating blood to the penis. And then you have, of course, age-related elasticity loss, which is minor changes. So we have collagen in our tissue, and then there's smooth muscle fibers, and it loses its elasticity. But the function of the penis does not change with that. So when it becomes a warning sign is when it's progressively getting worse, and there's concerns for vascular disease or poor circulation. I mean, if you're not going to the doctor, right? If you're not going at least once a year, do you even know that you have high blood pressure? Do you even know that you're diabetic? Do you even know that you're a risk for clogged arteries because you've had untreated high cholesterol for 20 years? If you aren't getting your routine wellness checks, then you don't know. There's some other issues like low testosterone that decreases the penile tissue elasticity and blood supply. There's a condition called Peyronie's disease, which is what happens when plaque formation or plaque forms in the penile tissue, which causes curvature and shortening. There are treatments for that. I'm sure some of you have seen the commercials for that, but also for those that have had a history of prostate surgery or pelvic radiation for cancer treatment, prostate cancer, That can lead to scarring of the tissue and nerve damage, which affects the length and the function of the penis. And then obesity. You get in that area, that suprapubic fat pad above the penis region can bury part of the penis. It's not really short, but it's just buried. And so some of us in the healthcare world call that disappearing penis or, vanishing penis. And sometimes you have to push in on that suprapubic area to get the penis to come out, to do procedures. And so very important. I'm a healthcare provider, so I do want to talk about it from a healthcare standpoint, but what can you do about it? Well, one thing is stay active. Regular exercise not only improves your health, but it improves your blood flow. Get those hormones monitored. If you're worried about it and you're, close to the age of 40 or 50 or whatever, and you've got concerns, go get your hormones checked. Remember, I told you to always get your hormones checked before 10 o'clock in the morning. Anything after 10 o'clock, if you get it at 2 o'clock in the afternoon, it's not going to be an accurate picture of who you are. I have just recently had he's a male friend of mine, but he's also reached out because he's fixing to switch services to me, but he's gone to 3 different places. I mean, this just happened in the past 3 weeks. 3 different places, had his blood drawn twice. None of them were before 10 o'clock. Every one of them, one was at 4 o'clock in the afternoon, one was at 2, and I think the other one was around 4:30 or 5 o'clock. His testosterone was completely abnormal. I mean, of course it was abnormal, but there was no, he was getting like 100 on one. He got 700 on another one. He got 500 on another one. And he's like, what does that mean? Well, you need to have it drawn before 10 o'clock in the morning. That's what that means. But again, he had been going to some places where they don't really focus on that. They just, and I hate to say it because I'm in this world, I'm in the healthcare world, but it is what it is. They just look for the money. They're not worried about the patient. But anyway, so the other things that you can do are eat healthier foods, your omega-3s, get those green leafy vegetables in, eat leaner meats, that kind of stuff. Decrease your sugar intake. None of us need all this sugar. I'm guilty of it. My husband's guilty of it. We intake more carbs than we should. Proper hydration. Make sure that you are avoiding smoking. If you're smoking, try to stop. Seek help for cessation of smoking. Limit your alcohol intake and manage your stress as best as you can. If it's persistent, you do these things and it's persistent or it's, becoming worse, you need to see a urologist. They specialize in, like the Peyronie's disorder. They can look at other disorders that may be causing problems, with like plaque formation, that kind of stuff. See a urologist. And I kind of wanted to briefly hit on all this because, it's a concern for men. Of course, if you're a man, again, if you Google what's the number one question that a man Googles for about his penis, is the size. However, the size, of course, yes, I know that's a big concern for you, but from a healthcare standpoint, what I want to get across to you is that, you've got to go and get your health screenings done. You've got to make sure that you don't have underlying health conditions. Just know that shrinkage itself is a blood flow response. It's not something that you're being punished for. If you go outside and it's 20 degrees below zero, well, your body's just responding like it's supposed to. The real danger isn't the size of your penis, right? That's what I'm going to tell you. I'm going to tell you as a healthcare provider. It isn't the size of your penis. It's the ignoring what your body is trying to tell you. So the key takeaways from this are: 1, the average size of an erect penis is 5.1 to 5.5. Stay away from the industry things, stay away from societal things, be truthful with yourself, be truthful among your group of men, guys, whatever. They will likely follow suit. And go get your screenings done. Get your health checked. Healthier foods, healthier exercise regimens, all the things. And I would love, love, love for you to email me your response to any of this, or, you can email me and say, hey, you're a woman, you don't know what the heck you're talking about. Like, shut your mouth, whatever. I did do research on this. I talked to some men, I did put some time and effort into this. And I hope that the key takeaway from this that you get is that go get your annual screenings done so that you remain healthy. And because the size of your penis, again, does not matter if you have blood pressure that's 200 over 130 every single day and then you have a stroke. It's not going to matter because that's not going to work anymore anyway. So go get your screenings done, get your hormones checked, reach out to me by email unmaskhelp@gmail.com. It does not have ED on the end of mask. And stay tuned for next week's episode because we're going to keep going into more sexual health, penis health, those sorts of things, answer more questions next week. In the meantime, stay unmasked, stay healthy.